anyone that's having any kind of surgery that requires aftercare, you got to listen up. I have with me Lori Getzweller. She's the owner of PostSurgicalRecoveryTeam, and she also has with her Dr. Robert Meger. Welcome to the show. You have to tell everybody a little bit about why it's so important for people to hire someone like you.
Thank you, Carol. Approximately 8 years ago, I worked in a plastic surgeon's office in the OR where I circulated, and after the procedure, I would transport the patient to their home or hotel and monitor them for an hour and a half to 2 hours. Then I go back to the office and we'd start the second procedure, and sometimes there was a snag where I'd have to stay with the patient a little longer. And in conjunction with this, I also worked at a surgical facility in Scottsdale where a lot of the top Valley plastic surgeons like Dr. Meger work there as well and perform their procedures. And I visited with the doctors and got their feeling on if they would have patients that would utilize a service like that afterwards. And so moving forward, I created the business and work with now 16 Valley plastic surgeons in the Valley.
Well, you know what? Here's the thing. You also said that to me before that this is something that anyone should use. It's having almost any kind of surgery. It could be even having a colonoscopy that they might need you. Even if they had maybe even a tooth pulled, if they don't have somebody that can take care of them afterwards. So tell us a little bit about your services and how you work with people.
Okay, our services, they start from 2 to 24 hours, depending on the doctor's protocol, depending on the procedure. We will schedule them. Generally, we need about 2 weeks out. We have picked up, on occasion, emergencies where their ride didn't show up, and we've done that as well. But mostly, it's 98% of our patients are from plastic surgery procedures.
Right.
And we'll pick them up depending on the procedure. Again, I can pick them up from a doctor's OR suite. I can pick them up from a surgery center. We pick them up, we monitor them from 2 to 24 hours depending on what they need. And we stay in close contact with the doctor. We're able to text back and forth, send pictures if something doesn't look right. And
Doctor.
Yes.
What have you seen out there? Like, what are some of the little things that could happen to people that they may not even realize?
Well, you can never send a post-surgical patient home that has been sedated without somebody to take care of them. So you can't put them in a taxi or an Uber. You just can't do that. So in cases where they don't have family members or someone that can take care of that, that's the service that Lori provides for us. So not only is it getting them home safely, getting them tucked in, making sure their medications are correct, but if there's a problem, then Lori has the wherewithal to, like she said, take a picture of the issue and send it to me, and I can look at it and we can discuss a plan together.
Now, I know you have a special that you're offering for everybody, so tell them what that's going to be. I
do. For any person that is looking to schedule an overnight monitoring care, whatever, for a full 12 to 15 hours, we offer a $100 certificate if they mention this show.
Oh, that's really cool. So you can see that up on the screen. But here's the thing, guys. I know a lot of people that have surgery, they get this plastic surgery done, and they don't realize how hard it is afterwards. It seems simple, but a lot of times things can happen. So you'd want to have them, you could call them. So what are there minimums? People can call you and do free consultation with you just to sort of talk about what it is that you do and how you can help them too, right?
Oh, absolutely. In fact, just recently we had a patient that was scheduled for 2 procedures, and she was a little worried about having them both done at the same time. And most all the girls that work on our team have all had a plastic surgery procedure done. So they put their mind at ease, and many times they've called back the doctor's office and say, you know what, I'm going to add that second procedure. I've talked to somebody who's going to take care of me. They've also had that procedure done, and both of them done, and they feel comfortable, so they'll go ahead and they'll add that back.
Now, Doctor, too, there's a lot of information that's out there on the web, and a lot of people go out there. One of the things that you wanted to talk about today that was important to you was that people tend to go online and try and get information. They change up everything that they were going to do because they believe what's online rather than to call someone like you and find out the real truth. Is that correct?
That does tend to happen more and more. We call it Googleitis. People look it up on Google, and next thing you know, they've got the symptoms that they read about on Google.
Right. So what do you think about it? What are some of the things that they even hear that you might want to tell them about to be aware of before they just go up there and do something that could be very detrimental to them?
I think definitely they've got to weed out some. If they pick a plastic surgeon, most all top Valley plastic surgeons are all going to have a before and after book, and they're going to be able to see before pictures and after pictures. They also, I would say, when they're reading a lot of negative input from patients, I think they really need to go through that and
So they need to really check it out.
Absolutely, absolutely.
And can they call you if they wanted to talk
all
to
the
you?
time.
I'm
and
sure they do.
They call us all the time.
Absolutely. You also were in Top Doc magazine as well. I remember you were in there. What was it? Not too long ago.
Just last year, and Dr. Meger was in there as well.
Well, congratulations to the both of you on that. This is a service that I believe that almost everyone should check into. So whether it's you or someone that you know, my mother had surgery a long, long time ago, and it was terrible then. It was awful. I know it's easier today, but afterwards, anything can happen, right, Doc?
Anything can happen, yes. Anything from anesthesia-related issues, fainting, falling down, that kind of thing, to surgically related issues, what we call a hematoma, which is a vessel that bleeds after the surgery. And there are just a myriad of different things that can occur.
Do you help people valley-wide?
Absolutely.
So you can help people valley-wide. And also, I wanted to talk to you. You said to me, Carol, before I come on here today, I also want to talk to people about some of the things that you'd like to do. You were talking about your neck and saying that you wanted to do that. I mean, and I know you've had a lot of procedures that you said that's one of the reasons why you understand them so well is because you've been through a lot of it.
I have, and approximately 20 years ago, 20 years ago, Dr. Meger did my face. He did a full face, brow lift.
Great job.
Thank you. I don't know where those 20 years went. But
I know, and so, there's...
So natural.
And everybody said that afterwards, too. I mean, I wasn't tight. I just looked so rested. And now it's been 20 years, so I need a little tune-up. Maybe
You got to make an appointment.
Yeah, well, yes, absolutely.
Doctor, do you do consultations? When they come in, how does it work with you?
Well, you have schedule an appointment, come in for the consultation, and we put you back in an exam room, and I come in and discuss what your goals are, what you want to do. And then we do an examination and figure out what the plan is for whatever it is that you desire. And
do you have anything new that you want to talk about? Because your world changes all the time.
I think the newest technology that we have now is a machine called the J-Plasma. It's not a non-invasive skin tightening, but it's less invasive. It's just a couple little incisions. Machine goes under the skin and it tightens the skin from the bottom. So it saves the big surgery and the incisions associated with those.
Sure. Now, also I wanted to talk about what you offer too, which is the information for them. I love that you give them tips. The last time you were on the show, you kind of talked a little bit about some tips that you also offer people, because there's a lot of things that they should get beforehand that you'll even go over with them so that they have it to make that surgery a success. The recovery, the surgery is a success. It's always the recovery part.
Absolutely.
That's when things happen. Go ahead and tell them about some of the things that you will tell them about.
Oh, I would say probably the biggest one would be the inner thigh lift. The Go Girls, we keep them in stock just so if we're on a case.
What's a Go Girl?
A Go Girl is a device that a woman, and I guess a woman would use when she has to void.
Okay, so yes, I think we talked about
the last time. And we also have caps for when the patients get their facelifts, when I transport them to the doctor's office for their post-op appointment.
You know, if you're going to spend money, you want to make sure that...
And these are so inexpensive. The cap is a UV protected screen all the way around because you want to protect, especially for the facelifts, you want to protect the sides where the incisions are. And see, I'm trying to... wedge pillows, we have everything. So if they don't have them there at home, but generally the doctor will give the patient to get list, and most certain all of the wedge pillows are on there. And
But it's always nice to have somebody like you that will do a consultation with them, go over everything. You'll feel so much more secure about what it is that you're doing, because you have to admit, I know people they're excited, they want to do something, they can't wait for the change, but they probably are a little bit reserved too at the same time. Is that correct?
Oh, yeah,
because it's a
absolutely.
big change.
It is.
But you did a great job. I mean,
Thank you.
I have to say, because most of the time we do see people where it's just too tight or whatever, and this looks very natural.
Oh, thank you.
And again, I want to talk about you and how you can help people when you go in. Some of the services that you offer, like I know you said you do overnights. What's the minimum? What is it that what's the least amount that you can do? What is?
We do 2 hours, and that's included with their transport. So generally 2 hours, we can get them home. We can monitor them. If a lot of times, like with the facelifts, the doctors have parameters that they want their blood pressure to stay, not to go above or below. We can monitor them for hematomas and bleeding, check for bleeding, make sure that they get their meds set up right. Generally, sometimes their Valium and their pain pill might come on at the same time, so we talk them in. We'll set alarms in their phone, make sure they stagger that a little bit.
You really do help them. That's great.
Yeah. And also too, we're finding a lot of our patients that are on the herbal supplements, like they're not.
We talked about that
yes,
one time.
they're
It's
just
very important for them to talk about everything that they're on, to disclose everything, because things can interact with one another.
Right. And the same thing, as soon as I get them home, after they start waking up, they'll say, oh my gosh, I have these herbal supplements in my kitchen you need to bring to me. And many times I have to text, if they look in their book, if they go to their doctor's pre-op, it'll all explain in there. And they have to really, really wait until the doctor gives them an okay.
I know you also wanted to talk a little bit about Botox today too. Okay, so let's talk about that. I mean, I know people are even buying that offline, online too. I think it's crazy, but go ahead.
Well, and I think Dr. Meger he might agree with this too. I mean, like, people will see Groupons, or Botox parties advertised, and they'll have it on there for $7 a unit, $8 a unit, but you want to make sure that and I think that's how my face has stayed pretty good, except for my chin, my neck.
20 years, I think it's a good
20
run.
years, yeah.
But I think that if you do the Botox even afterwards, you just get so much more length out of your.
But you got to be careful of where you're getting it.
Absolutely.
Right? It's just not. You can't just go on Groupon and say, I'm going to go and have a Botox party and have people come in and inject me in my face or something like that. It just seems so crazy to do.
No, it's so much easier just to go to a facility or a doctor and let them. Yeah.
And Doc, how long have you been doing this?
20 years.
So 20 years.
Yeah,
So you started.
and change.
Right at the beginning.
Yeah.
Well,
Right.
and some of the different things that you can offer are facelifts. Do you do body shaping and all of that too?
Yes, tummy tucks, breast augmentation, liposuction,
Right.
ears, eyelids, the whole gamut of cosmetic surgery.
There's so much out there, but again, you want to make sure that you're taken care of. And for you, it's all about the aftercare. You're valley-wide. You help people all over. What do they need to do when they call you? You do a free consultation. What is it that they need to do with you first?
First of all, we ask who their doctor is, what procedure they're having done, if they're staying here in the Valley or at home. And then a lot of times I will call the doctor and we'll verify, we'll go over everything. We get an H&P, which is a history and physical on the patient, and we find out if they have a problem with hypertensive. And so we just kind of go over everything that they're going to have done. And then we go into about how their home is prepared, what they're going to. I generally suggest they don't have to buy them, but like recliners for the tummy tucks, the doctors like them to stay at a certain degree. And I found myself that even renting a recliner for a month was just amazing.
Right, so there's so many things that you can offer them, not just the service, but you give them ideas of how to make it even better for them so that they have great success with their surgery. Again, they're valley-wide, and I always say this, maybe it's you, maybe it's someone that you know that might be having some surgery. And again, you said 98% of them are mostly people that are having plastic surgery, but we know that if you don't have a ride home for a colonoscopy, even if you're having wisdom teeth pulled, there's a way that you might need their services. So give them a call. They do a free consultation. This is something that you don't want to play with. You're paying the money, so you might as well get it done right in the first place. They offer their free giveaway that they're offering, which is a $100 gift card for a 2-hour stay or more, and you can check them out. Don't be looking at on the web and trying to get all your information from there.